Hi, I'm Dr. Margreet Barnard, your host of the Birth and Baby Show, brought to you by Birth and Baby and Sensitive Midwifery. We empower moms, midwives, and birth workers to have the best birthing and parenting experience through natural, physiological, and intuitive care, resulting in birth and baby advice you can trust. This episode is sponsored by Probitec. Did you know cranberry doesn't actually kill the bacteria causing a UTI? The real magic lies in tiny compounds inside cranberry called packs, which help stop harmful bacteria from sticking to the urinary tract, so they can simply be flushed out when you pee. But here's the catch. Most cranberry products don't contain enough of these packs to make a meaningful difference. Probitec UT Cran was designed differently. It delivers 72 mg of packs, double the research's minimum threshold, using advanced phytosome technology combined with 30 billion probiotic bacteria to support the microbiome environment involved in this process. Today, we unpack the fascinating science behind recurring UTIs, the microbiome, and why activated cranberry may be changing the conversation around urinary tract health. Hi, everyone. Welcome back to the show. For today, we are going to unpack UTIs, urinary tract infections, which is a very common condition for women and specifically women when they are pregnant. Now, why is that and how can we prevent it? And more importantly, how can we treat it? And trust me, today's episode won't be talking about just grab an antibiotic. It will be much better. So for today, to help us unpack the real science and prevention and recovery, I'm joined by Jason Stewart. He's the driving force behind Probitec Health. Jason is based in Cape Town and is really deeply passionate about translating complex human microbiome research into practical evidence-based health solutions. And he has an amazing solution for UTIs. Hey, Jason, welcome back to the show. Excited to have you today. How are you doing?
Thank you. Yeah, very good. Thank you. Very excited to be back talking to you.
Yeah, no, it's been really great. We've done a previous podcast where we laid a lot of foundations on the microbiome and probiotics for that matter. I think it's really a trending topic, and many people are curious about it and learning about it, and rightfully so. And for today, we're going to be talking about UTIs specifically, and I know people will be wondering what it has to do with the microbiome, but it has a lot to do with that. So UTIs, I know from a midwife's point of view, it's a very prevalent condition, especially when you're pregnant. For women that might never have had UTIs before, all of a sudden they're pregnant and they suffer with UTIs. Why is that, Jason?
Yeah, so I think we all know that women are more susceptible to getting UTIs more so than men, and this is exacerbated during pregnancy. So first starting off with why women are more prone to UTIs is the urethra is a lot shorter in women than it is in men, and then anatomically it's closer to the anus. So mechanistically it's easier for the bacteria to transfer. And also based on that as well, just linking to your previous comment of why it's linked to the gut microbiome, is the bacteria that cause these urinary tract infections come from your gut as well. And so they're part of that environment. But what happens during pregnancy is a lot of things change. Your immune system is slightly more compromised, so you're able to get more infections. The vaginal microbiome itself changes as well. So the species of lactobacilli that make it a more acidic environment actually reduce. And so you're opening this up to make an environment that pathogens and infections can also get into. And then also, interestingly enough, your progesterone is increasing, which means that your muscles are relaxing, which even affects the bladder, which means that you are flushing out less urine, and cause an environment where you're not actually getting rid of those pathogens as much. So it's a number of different factors that already there's a high infection rate within women, and then the onset of pregnancy exacerbates that. And then even post-pregnancy, when your estrogen levels drop, that causes another shift where there's less glycogen in the vaginal tissue, which is what lactobacilli strains consume and need to live, which again creates another environment. So it's creating an environment that is prone to infection. And I think on top of that, within South Africa, there does seem to be an epidemic of UTIs that are affecting women who kind of just seem to believe that they need to live with the symptoms and try and kind of dampen it down or manage it, when that essentially isn't the case. But yes, within pregnancy, there is a very high infection rate, and you want to get rid of that as well.
Yeah, sure, absolutely. You explained that so well. Sure, what a thing to be a woman, eh?
Yeah.
No, we used to
Just
that, but
total respect from my side, and yeah, I don't think a man can complain about anything. We're
sure.
ignorant to life. Yeah.
Yeah, well, thank goodness for men that are really empathetic and bringing solutions like yourself and being so knowledgeable. Um, what you said there was interesting and made me think. You mentioned that the link to the gut microbiomes because it carry the actual bacteria that will give you a UTI. So
Yeah.
that then is obviously important that also outside of pregnancy and specifically if you want to conceive that you focus on your gut. Am I right?
Absolutely. So your gut microbiome we're becoming more and more aware of how central that is to overall health. And it affects so much of every aspect of us, of our health, from impacting our metabolism to cognition to our brain, but importantly to our immunity as well. And the gut microbiome needs a lot of good gut bacteria because it needs a lot of good bacteria. And if it doesn't have a lot of good bacteria, little things like changes in the pH level can allow space for infection to come in. But there are links as well to a state of dysbiosis and struggling to conceive as well, specifically in the vaginal area. Yeah.
Interesting. Yeah. Sure. Preconception care is really important for so many things. Yeah.
Absolutely. And I think we spoke about it before in the previous as well, but even in terms of the effect that your gut bacteria have on your developing baby within you, because what is happening is your gut bacteria are producing special metabolites like short chain fatty acids, immune signaling molecules, and those are crossing across to the baby through the placenta and influencing how the baby's immune system is developing. And there's some
Wow.
fascinating studies that have been done tracking the diet of mothers that are pregnant and the development of their children later in life, taking stool samples on a monthly basis, for example. And you can see that there is a direct link there. And so we never think of our gut bacteria, but they play an incredibly important role in the foundation of what we, how our children develop through life.
Wow, interesting. There's so much we can we can do. I feel in the preventative space, Jason. You mentioning the diet and the food we eat. When we link that to pregnancy and UTIs, what foods could make us more susceptible for UTIs, and what can we do to prevent them if we take it to that level?
Okay, so that's always great. And I think it's really important is that affecting your microbiome is very easy to do negatively or positively.
Mm,
And the things that we love and crave, the sugars and the high processed foods, are what feed your pathogens and the bad bacteria. And so we can't always have full, complete control over what we want to eat. But knowing that if we're eating a high sugar diet, we're going to be feeding the bad bacteria because that's what they consume and grow. What has been shown to be very, very good, especially within pregnancy and for all humanity, is a high fiber diet, specifically looking at fibers that are high in prebiotics. as well. And so an important distinction is prebiotic fiber is a specific fiber that feeds your good gut bacteria. That good gut bacteria also then has an impact throughout your body and feeds the other bacteria as well. But those are things like there are specific foods, but like onion is very high in prebiotics. A lot of your vegetables, even your fruits, it's your fermentable foods that the bacteria consume and convert. Yeah.
Awesome. Yeah. So the sugar is definitely the thing to not take, and then up your intake on just your onions, your vegetables, your fruits on a daily basis.
Yeah, and then add in fermented foods if you
Mm.
if you can. To be honest, I'm not a big fan of that, but I try and have some kimchi and some kefir yogurt and the rest of that. But all of that is the simple stuff that we should be eating. The
Yeah.
more that you can eat, the better. Yeah.
Yeah, totally. Great. So I can't help but have a little rabbit trail because
Yes.
when we talk about sugars and diet and pregnancy, even outside of pregnancy, many women also have, and I think it's interlinked, struggle with candida and thrush. So how that is all interlinked, if I'm correct.
Yeah, it's also linked, and it's about that having a capacity to grow and flourish within that environment. So it's you might need an antifungal, but it's about shifting that environment and making sure that it's not conducive for them to thrive and to grow. Yeah.
Yeah, yeah, it's very important to see that the origin of it all. And then
Yeah.
the most common treatment that we know is to go on your antibiotics for UTI. Um,
Yeah.
and then you probably find, well, in my experience, I found you treat the wound for UTI. The next time you see her, she comes back with a thrush infection, and then you need to treat the candida. And they in this
Yeah.
repetitive cycle of dysbiosis there. So please unpack for
Yeah.
us the treatment and yeah.
Cool. Yeah. So antibiotics are critically important, and they've played a very good role within within civilization. But what is really critically important, especially within pregnancy, is antibiotics can be used, but need to be used for the right reason and as limited and as few instances as possible for to ensure your health. What I'm trying to say there is not the overuse and the unnecessary use of antibiotics, but when you're treating a UTI, there are specific antibiotics that are used that attack the bacteria. And the two main bacteria that are involved in UTI infections and that are responsible for around 90% of them is an E. coli and then another one called Klebsiella. The E. coli is about 85% of infections are caused from that. And the challenge with antibiotics is that if the antibiotic doesn't kill all of the bacteria, whatever is left can become resistant to that. And bacteria are very, very good at transferring genes horizontally, which means they can just, basically throw it across to somebody else. It's not exactly like that scientifically, but it's very easy for them to transfer that. And then what you do see, and this is something that we've experienced and we've heard back from many, many women of being on courses and multiple courses of antibiotics, even a woman who was on an antibiotic for 20 years for a UTI. And that is showing that the solution isn't working. And in that case, you need to look for alternatives. You do have complicated and uncomplicated UTI infections, and obviously you need to follow your doctor's advice. And we're not saying don't take antibiotics, but it's not a cure for every single urinary tract infection that is out there, but they do play an important role.
So interesting. Yeah. So would there be another way then to go about treating UTI, or if we don't want to
Yes.
go with antibiotics, what is the
So
alternative then?
there are alternatives, and I'll explain two of them to you. So I think to explain the alternatives, it's nice to understand how the infection actually stays put, because most people don't know that. But if you look at an E. coli bacteria, for example, and you look at my pen, it's kind of like a rod shape, and then it has lots of these little hairs that come off it. And at the end of these hairs are little hooks. And they use these hooks to hook into the inside of the urinary tract, and they stay there and they slowly work their way up. But the reason you can't get rid of them is because of these hooks on all of these multiple hairs on them. And so there are two main key alternative ways of getting rid of UTIs. The one is an ingredient called D-mannose, which you may be aware of. And you need a lot of D-mannose within that environment. And what happens is instead of the E. coli hooking onto your urinary tract, they hook onto the D-mannose, and then they don't grip onto, they don't stay put, and then they can get flushed out. The challenge there is you need to know that you're going to have an infection and make sure that your D-mannose is very high and be supplemented with a very high dose, because once they're hooked on your urinary tract, they won't release and hook onto the D-mannose. The
Sorry,
other
I've
way
never heard
is
of that. D-mannose.
D-mannose, yes, yeah, no, it is a popular alternate option, yeah.
Okay, and
yeah.
where are they found in D-mannose?
D-mannose is they're also an alternate to antibiotic natural ingredient supplement, yeah.
Okay.
And there, I mean, without getting too technical, but you should be, I think it's around, you need to be supplementing with about, and this is also really important with any form of supplementation, is being able to look at what the studies that prove the effectiveness of the ingredients of what dose rate and type of dose you need. So I think with D-mannose, you need to be supplementing with like 2 grams of it every 2 to 3 hours for 24 hours before the infection, and then 2 grams twice a day, for example, which people aren't doing because you don't know that you're going to get that infection generally. The other alternative, so you've got antibiotics and D-mannose are kind of 2 of the top 3, is Cranberry. And most people know Cranberry. You'll hear somebody say, I'm drinking cranberry juice to get rid of my UTI. The truth is you need to drink about 12 liters of cranberry juice per day, which itself has about 2 kilograms of sugar, which is going to feed all the other bacteria. So good luck if that is your strategy. But what is interesting is we know cranberry is associated with getting rid of UTIs, but people don't know how that actually works. So it's not the cranberry itself that works. It's an active compound, and this is going to get technical, but an active compound called an A-type PAC. And so the way that I try to explain it is, imagine that you've got 10 liters of Oros juice. You've got the water in there, and you've got the Oros concentrate. You don't say you've got 10 liters of Oros, you've got maybe 2 liters of Oros with 8 liters of water. That's kind of the same with cranberry. We don't care how much cranberry there is, we care how much of the A-type PAC is within that cranberry, because every single product has a separate dose. But this is where your gut microbiome gets involved as well, and this is where it gets really interesting, is you consume the cranberry, which has the A-type PAC, that goes into your gut, and then your gut bacteria eat it and convert it into a metabolite called a valerolactone. And you can forget all those fancy names, but just understand that you need the active compound and you need bacteria, and they convert it. And then what they do is, if you remember, the E. coli have these little hooks, and they hook onto your urinary tract. It flattens those hooks out, and it makes the environment very slippery, so that they can't actually adhere or grip onto anymore. So you don't necessarily need to kill them, you just make it impossible for them to stay there. And then when you urinate, you flush them out.
Sure.
And so that's how that works. But the complication comes in that the studies and the research shows that you need at least 36 milligrams of PAC. And now, not all products actually disclose that, so it's very difficult. You need to look at the and I urge anyone watching this, try and look at the back of a pack to see if they say how many PACs or proanthocyanidins. I'm using a lot of big terms or words, but it's really critically important. And you need to make sure that you have at least 36 milligrams of PACs in order for that dose to be effective and high enough to flatten out the hooks and to make the environment slippery so that you can get rid of that bacteria.
Sure, that's the first time I hear it so well explained, because the Cranberry theory myth for UTIs is
Yeah.
out there, as we've always heard of it. So there's a half truth in it, clearly. So
Yeah.
it's very interesting how you explain it, that it's about a compound in the cranberry, the PIC, that then combines with a organism in the gut and do their job. So
It's
it's
amazing.
crazy,
Yeah.
yeah. So there must
Yeah.
have been some interesting research going on about that then, and it's good for people to know.
Yeah.
And Jason, with the current products that are out there, you you err with caution then on using it for its effectiveness.
What do you mean by we err on caution? So,
Because you say there's maybe not enough compounds in there to make it
yes.
effective. So this may be a bit of
Yeah.
a, you know, again, a
Yeah.
money-making scheme on it because it says cranberry, but it's not effective enough.
So, um, I'll be careful. You said that, I didn't, about
Yeah.
the money making scheme. But yes, and I think that is a general issue within the world of supplementation, is because we get our information from hearsay and from research that we've done that's not always kind of clinically validated or accurate. And we know we may need vitamin C. There's things in the news about peptides. We want creatine, but nobody understands kind of what those clinical studies say. And it's about understanding how to go and find that information, which most people don't have the time or the inclination. They say, okay, I'm just going to take some creatine, or I'm going to take vitamin C. But you don't know if what you're getting is actually in the right dose amount or dose format to actually make a difference. And that is a general kind of challenge within the industry. So when looking for a cranberry-based product that can actually work, yes, you need to look for at least 36 milligrams of PACs, and then ideally for it to come combined with something that supports your gut microbiome as well, because that conversion needs to take place. And you can't have that if you have dysbiosis, which is an imbalance of your good gut bacteria, and you don't have enough of good gut bacteria. Yeah. So maybe that is, can I mention Probitec UT Cran?
Yes, because that was going to be my next question, because
Okay.
you've combined all the research and the knowledge and came up with a solution, or the company behind you.
Yes. So being led by what research shows is effective. So we have developed this product, Probitec UT Cran, and I'll pop one of the capsules out. What we have here is, remember I said we need at least 36 milligrams of PSCs. So this daily dose is 72 milligrams of PSCs. So it's twice the dose amount. And then we combine it with prebiotics, and prebiotics is the food for your good gut bacteria. So it's going to amplify the community that you have already inside you. And then we also combine it with 30 billion bacteria, so a high dose of bacteria. So the results on this are phenomenal. And you can see there, the capsule is quite different. There's a cap within a cap. And so this is targeted release of those ingredients into your intestine where your bacteria are. So it's a highly effective product. And at the right dose amount that will help stop all that bacteria sticking and adhering inside the urinary tract infection. And anecdotally, we've had some phenomenal feedback from women that have been struggling with UTIs for 2 years, 5 years, 20 years, and being able to take this and feel that relief, and importantly, that elimination of the urinary tract infection, because you shouldn't have to struggle with getting rid of a UTI. It should be relatively straightforward to get rid of it. Yeah.
Wow, that's amazing. That's amazing. Thanks. It makes so much sense with the way you've explained it, Jason. It's a no-brainer.
Yeah.
And
Yeah.
why antibiotics is not the real solution, because you keep weakening the microbiome and the disbalance of the organisms
Yeah.
that grow, so it keeps reoccurring. I think
And
I overheard one question from a doctor at our event, the symposium, that says, "Yeah, but how much does this cost? An antibiotic treatment is way cheaper." um,
yeah,
but
it's actually not.
it's probably
So
not. Hey.
yeah, so this is cheaper than your standard antibiotics. It is more expensive. It's anywhere between 390 and 415 rand in store. and you're spending more on that on a course of antibiotics to get rid of it. And I think it's a really good point there, because price can be something that makes us stop buying the right products, but
Yeah.
you also often get what you pay for. And with Probitec UT you have one course of 7 days that should help eradicate and eliminate that infection. And if you look at the women that are struggling with recurrent UTIs, they're going to the clinic multiple times, or the doctor, they're spending money on antibiotics and supplementation. And so it becomes very expensive. So not even taking account the effect that it has on your life. So this is a phenomenal product. And we also, in addition, pack it with folic acid, fourth generation folic acid, vitamin B12 and D3. So you've got a whole kind of comprehensive immune support, energy support system there as well. So it's a
Amazing. And
powerful product and
yeah,
safe in
it's
pregnancy.
amazing. And
Yeah,
then obviously the restoration of the microbiome, because it's got that aspect also,
yeah,
um,
yeah.
so that it doesn't
And
keep coming back.
And I think one important thing as well is you can take this with an antibiotic as well. So if your doctor is
Okay.
very um, um, kind of wants you to take an antibiotic, you can take it with an antibiotic. We have these very special capsules that only release the ingredients in the probiotics when it gets into the intestine, and that's about after 105 minutes. So that's delayed release. So it supports you taking the product at the same time. And something that you were talking about as well, which is an interesting point, is there are so many people that have taken antibiotics and the antibiotic has helped them get rid of something, but then it has led to an imbalance that has caused other problems. And so that's why it's critically important, if somebody's taken antibiotics, to support their gut microbiome with both prebiotics and probiotics so that they can bounce back faster, because many people will be on a course of antibiotics. And as you said, you get thrush or candida or something, or struggle with bloating or constipation thereafter. And it's because we haven't recovered yet. And that leads to other immune issues and brain fog issues and that.
Yeah, exactly. Sure. I think this is such an amazing answer for many women's problems. And I'm convinced, I never really thought that you can get rid of a UTI without taking antibiotics, to be honest. So
Oh, great. So,
there's a lot of awareness needed
yeah.
around this. And I'm sure many healthcare professionals will be very happy to hear about this alternative.
Yes.
And obviously for women that are quite knowledgeable about their bodies and are diagnosing themselves, can they just go get it over the counter as a first line of treatment?
Yeah, you can, absolutely. So you can find us in a discount or clicks. Often if you'll go to a doctor or a clinic, they might ask you to do a P test to see if you have a UTI or not. But it's off the shelf, so you can grab it, which is great. And also importantly, it's very good for vaginal health as well. So there is no downside to the product. It's the strains are, as I said, safe in pregnancy, but lactobacillus based, which is you want within the vagina, very few species or strains, lactobacillus predominant as well. And so that's also why we have used those strains.
Okay, so would it then also be a product that you can advise for women having candida issues and thrush
Yeah.
issues?
Yes. Yeah. Yeah. And then what I would say there is potentially one capsule per day, where for a UTI, you're looking at 2 capsules per day.
Okay. Yeah, just to get
Yeah.
that dose as high. All right.
Yes.
Wonderful. Um, Such valuable information, and I'm sure many women will be trying this one
Mhm.
out. Jason, from your side, anything else in and around UTI and prevention? Anything you want to share still with our audience?
I think maybe just one thing that for some reason has popped in my mind, but drinking lots of water is obviously very good, and hydration.
Yeah.
So that's just a simple thing. It's similar because we have the probiotic range as well for gut issues, and it's similar when people have things like constipation. It all comes down to the simple stuff of drinking more water, eating more fiber, moving more often. That will ease a lot of the symptoms. But also with the UTI, hydration is obviously very important as well.
Yeah, totally. Thanks for
Yeah,
adding that.
and diet and fiber. Yeah.
Yes. Yes, so important. And that's what pregnant women sometimes battle with, because they have a big preggy belly on their bladder and they don't want to drink much. We see,
Yes.
and it is crucial for prevention and for overall
Yeah.
health. Yeah.
Yeah.
Great. Jason, thank you so much. I really appreciate all your knowledge. It's always so interesting to listen to you with your scientific insights on the
Mm.
how-tos, and I like to be informed, have informed decision making, and this is so
Yeah.
informative for that.
Awesome. Thank you,
Yeah.
Makrit, and thank you for your time. It's always great to chat.
Awesome. Thank you.
Cool.
Enjoy this episode, please share it with a friend who would benefit, and remember to subscribe so you never miss a new release. If you're watching on YouTube, hit that bell icon for notifications. And if you're listening on your favorite podcast app, please leave us a rating or review. It truly helps us reach more people. We'd love to stay in touch and keep you equipped with our latest resources. Midwives and birth workers, head over to sensitiveMidwifery.co.za/free gift for your special resource. For moms, visit birthandbaby.co.za/free gift for more training and support. You can find both of these links in the show notes or description below. Thank you for being part of this community. And remember, you are making a big difference because you are shaping the future of humankind. Thanks for joining us, and I look forward to journeying with you.